Roman Reigns pulls out of WrestleMania 36. Who is Roman Reigns? Why did he pull out of WrestleMania? Why does his diagnosis put him at risk of infection? And should the WWE continue with WrestleMania 36? Stay tuned to learn more. Hey everybody, Dr. Chris, orthopedic surgeon and sports medicine physician. Welcome to my channel, your number one source for information on orthopedics and sports medicine injuries that's easy to understand for everybody. And I do mean everybody.
Okay.
If you want to know more about my life as an orthopedic surgeon, be sure to follow me on Instagram or Twitter at Stable Knees. I'm also on TikTok at Dr. Raynor. If you're looking for workouts, exercises, or information on injury prevention, be sure to check us out on our sister channel on YouTube, Cuba 2.0. And of course, as an educator, I'm on a mission to teach everybody about orthopedics and sports medicine. Help me accomplish this goal by sharing this content with everybody and anybody who you think may be interested in this topic. WrestleMania 36 is the 36th annual WrestleMania professional wrestling pay-per-view scheduled to take place April 4th and 5th of 2020. It was to have taken place at the Raymond James Stadium in Tampa, Florida. However, due to issues related to the current coronavirus pandemic, it was moved to the WWE Performance Center in Orlando, Florida instead. The WWE released a statement which stated the following: in coordination with local partners and government officials, WrestleMania and all related events in Tampa Bay will not take place. However, WrestleMania will still stream live on Sunday, April 5th at 7 p.m. on WWE Network and be available on pay-per-view. Only essential personnel will be on the closed set at the WWE's training facility in Orlando, Florida to produce WrestleMania. The event has been moved to the Performance Center due to state regulations enacted to attempt to stop the spread of the coronavirus with the hope of flattening the curve. For more information on what this means, see my previous video on what the coronavirus means for the young and the healthy. I'll leave a link in the description down below. In a recent interview with Variety, Stephanie McMahon detailed exactly what the WWE was doing to take safety precautions while filming content for the WWE during the coronavirus pandemic. At a typical event, talent are milling about, they are at catering or wherever when they are not actually in part of the show. That's not allowed now. There's extensive testing and screening when you first come in the facility, regardless of whether you are talent, crew members, or anyone else. Working with our doctors, you have your temperature taken. If you have a temperature over 100.4 degrees, you are automatically asked to leave. McMahon also stated that anyone who had been out of the country or in touch or contact with anybody who had been out of the country would not be allowed into the facility. She added that we are taking every precaution we can. It's also why you don't see talent or anyone else in the audience. We really are adhering to all the guidelines that we can to maintain the health and safety of our crew and our members. Ryan Satin of the Pro Wrestling Sheet reported that WrestleMania would likely include off-site matches not filmed at the Performance Center like most of the other matches. He stated that those shows would be done with essential personnel only in order to allow them to proceed. The WWE stated that they would be adhering to or following CDC guidelines and state or local mandates to allow the match to proceed when asked how many people would be allowed to be present. This is the approach that some have suspected will be used by Dana White and the UFC in the upcoming Khabib Nurmagomedov versus Tony Ferguson event scheduled for April 18th of 2020. McMahon additionally noted that the WWE had requested that all talent stay in Orlando and not travel during the extensive taping. The county where the WWE Performance Center is located issued a stay-at-home order on March 26th of 2020, which remains in place until April 9th of that same year. On March 26th of 2020, the Pro Wrestling Sheet Satin reported that Roman Reigns would not be part of the WWE Universal Championship match at WrestleMania 36 as had been previously planned. He stated that Reigns had expressed to the WWE that he did not feel comfortable doing any of the Performance Center shows during the coronavirus pandemic. Reigns stated that he did not want to risk his health. The WWE honored his request and has made plans to replace Reigns in the match against Goldberg. So this leaves us with a few questions. Number 1, who is Roman Reigns? Number 2, why did he pull out of WrestleMania? Number 3, why did his diagnosis put him at risk of infection? Or at least more risk of infection than anyone else in the regular population? And finally, number 4, is it a good idea for the WWE to continue with WrestleMania 36 in light of the current pandemic? So question number 1, who is this Roman Reigns guy anyway? Leotai Joseph Anoa'i is an American professional wrestler, actor, and former professional football player. He is currently signed to the WWE as a member of the SmackDown brand. He wrestles under the name of Roman Reigns. Prior to professional wrestling, Anoa'i was a member of the NFL's Minnesota Vikings and the Jacksonville Jaguars before playing a full season with the CFL's Edmonton Eskimos, after which he was released. Having come from a family of established wrestlers, he retired from professional football to then pursue a career in professional wrestling. He signed with the WWE in 2010 and debuted on its main roster in November 2012 with Dean Ambrose and Seth Rollins as The Shield. In 2014, Reigns entered singles competition. Presently, Reigns' record includes being the 4-time world champion in the WWE, having held the WWE Championship 3 times and the Universal Championship once. His other accolades include being the United States Champion, the 1-time Intercontinental Champion, the 1-time WWE Tag Team Champion with Seth Rollins, the 2015 Royal Rumble winner, and the 2014 Superstar of the freaking Year. In 2018 at SummerSlam, Reigns defeated Brock Lesnar to become the Universal Champion for the first time in his career. Reigns was later scheduled to be involved in a triple threat match with Braun Strowman and Brock Lesnar yet again for the Universal Championship. This match was to have taken place at the Crown Jewel event in Riyadh, Saudi Arabia on November 2nd of 2018. However, on October 22nd, Reigns unexpectedly relinquished the title and announced his hiatus from Raw as a result of ongoing medical issues.
My real name is Joe, and I've been living with leukemia for 11 years, and unfortunately it's back.
Several months later, on February 25th of 2019, Reigns returned to Raw, revealing that he was once again healthy and cleared to wrestle. Having made his return, Reigns was subsequently drafted to the SmackDown brand after the 2019 WWE Superstar Shakeup. That kind of sounds like some kind of X-rated, raunchy exercise device or something. In November 2019, Reigns challenged Goldberg for the Universal Championship, leading to a match between the two being set up for WrestleMania 36. As I noted earlier, this match was to have taken place on April 5th of 2020, but was subsequently relocated as a result of the coronavirus pandemic. After being moved, the event took place on March 25th and March 26th of 2020, but is scheduled to air on pay-per-view on the WWE Network on April 4th and 5th. So this leads us to question number 2. Why did Roman Reigns pull out of the WrestleMania 36 event? Reigns first took a medical leave of absence from the WWE on October 22nd of 2019. At that time, he revealed that he had become ill with leukemia. However, this was not the first time that he had been stricken with this diagnosis. He was first diagnosed with leukemia in May 2007 when he was still signed with the Minnesota Vikings. He entered into treatment at that time. Later, approximately 2 years after his initial diagnosis, his illness went into remission and he has been healthy since then. The The return of his illness in 2019 was only discovered after he had undergone routine blood work, as he had not been feeling unusual or unwell. When he announced his medical leave in October of 2019, he stated that he would go on an indefinite hiatus in order to receive treatment. He also stated that he had not previously publicly announced his diagnosis, as he had been in remission. In an interview with Tyler Conway of the Bleacher Report on March 5th of 2019, REIGNS stated that in 2007, he had been initially diagnosed with chronic myeloid leukemia, a slowly progressive disease that is typically caught during routine blood work, much as it had been in October of 2019. Leukemia is a group of blood cancers that typically begin in the bone marrow and that result in significant proliferation or overproduction of high numbers of abnormal blood cells. Usually, these blood cells are incompletely developed and are known as blasts or leukemia cells. This disease is associated with a number of symptoms that may include bleeding and bruising, feeling tired or fatigued, fever, and an increased risk of infections. These symptoms are caused by a lack of normal blood cells. The diagnosis is generally made by way of blood tests or a bone marrow biopsy. Leukemia is typically divided both clinically and pathologically into large groupings that include either acute and chronic, or lymphocytic or myelogenous. Acute leukemia is characterized by the rapid increase in the number of immature blood cells. Chronic leukemia, on the other hand, is characterized by the excessive buildup of relatively mature but still abnormal white blood cells. Leukemia is also subdivided according to which type of blood cell is affected. Lymphoblastic or lymphocytic leukemia describes leukemia where the cancerous change takes place in a type of marrow that normally forms lymphocytes, which are infection-fighting immune system cells. Myeloid or myelogenous leukemia describes a form of leukemia where the cancerous change takes place in a type of marrow that normally goes on to form red blood cells, platelets, or other types of white blood cells. Various combinations of these two groupings produce four main categories of leukemia, which include acute lymphoblastic leukemia, acute myelogenous leukemia, chronic lymphocytic leukemia, and finally, chronic myelogenous leukemia. Chronic myelogenous leukemia, or CML, the type from which REIGNS suffers, typically occurs in adults. It has several subtypes, and overall, the 5-year survival rate is over 90%. It is important to note that while leukemia is associated with a high number of white blood cells, the extra white blood cells are frequently immature in nature or dysfunctional, meaning they don't work very well. Systemically, however, this leaves the patient afflicted with leukemia prone to infections. Given this susceptibility to infections, it is no wonder that REIGNS elected to remove himself from the planned WrestleMania 36 competition, since he was known to be immunocompromised as a result of his ongoing battle with the disease. So question number 3, why does REIGNS' diagnosis put him at an increased risk of infection? The coronavirus pandemic is caused by the SARS-CoV-2 virus, which produces the COVID-19 disease. This virus is highly contagious and has a long incubation period. Consequently, this disease can remain hidden within the population and quickly spread throughout the community. Although the disease is mild in up to 80% of the population, it can be severe in the remaining 20%. Even now, there are people walking among us who are infected but do not yet know it, and they are shedding the virus the whole time. Those who are particularly at risk of infection include the elderly, the immunocompromised, and those with a history of chronic illness. Those populations are particularly at risk of both becoming infected and suffering a malignant or severe form of the disease. Although most people have been encouraged to self-isolate themselves in their homes, it is these populations for whom this is most important, as they are the population who are most at risk. With their compromised immune systems, they have a reduced ability to fend off infection with the SARS-CoV-2 virus and to mount an immune response that could help to protect them and save their lives. With inadequate defenses against the virus, if they became infected, the virus would be allowed to proliferate unchecked, wreaking systemic havoc in the infected individual. It is quite understandable that REIGNS, who at the best of times would be at risk as a result of his chronic diagnosis, would want to minimize his chance of contracting this illness, which at its worst could prove for him to be fatal. Participating in an event like WrestleMania 36, even in its restricted, pared down format, would still prove to be somewhat risky for someone who is immunocompromised. Although social distancing is a necessary step in the eradication of the coronavirus and important for us all, it is even more important for REIGNS. And the last time that I checked, wrestling face-to-face in the middle of the ring at WrestleMania 36 has not been endorsed by the CDC or Center for Disease Control as an effective social distancing tactic. Upon his return to wrestling in February of 2019, REIGNS stated that he had been treated using oral chemotherapy. He added that, "It's not like taking Advil. It's nothing like taking radiation and true chemotherapy, but it does have its side effects. It does have its nastiness about it. But at the end of the day, if you're lucky enough to just take a pill, I think you're ahead of the game." Currently, the standard treatment for chronic phase CML is a tyrosine kinase inhibitor, like imatinib, lenvatinib, dasatinib, or bosutinib. What did I just say? But basically, these are just a class of medication that inhibit a process that involves one of the essential amino acids. These medications, unlike other chemotherapeutic agents, have relatively few side effects and can be taken orally at home rather than at the hospital. The side effects of these medications include, among others, nausea, vomiting, diarrhea, headaches, leg aches and cramps, fluid retention, visual disturbance, itchy rash, lowered resistance to infection, bruising or bleeding, loss of appetite, weight gain, reduced number of blood cells, neutropenia, thrombocytopenia, and anemia, and edema. Did I mention increased chance of infections? So, whether in treatment or in remission, either way, infections and his potential exposure to them are a significant problem for REIGNS. I suspect that we won't be seeing REIGNS participate in any events until the pandemic is well under control. So finally, this leads us to question number 4. Is it a good idea for the WWE to continue with WrestleMania 36 in light of the current pandemic? Some essential services must continue during the pandemic. These services allow society to continue functioning, albeit in a reduced form. As a medical professional, I can't say that the WWE quite fits the bill. And I know that some of you might not like that, but I'm calling it like I see it. Many other forms of entertainment have been canceled in response to the pandemic. You would think that the WWE would be the same. What do you think should happen? Be sure to let me know in the comment section down below. Although Satin reports that the WWE has apparently already filmed several subsequent episodes of WWE in advance, I don't suspect that the coronavirus pandemic will be under control anytime soon. I expect social distancing to be in effect for an extended period of time, and I expect REIGNS to be absent for quite a while. I look forward to his return to the ring when this is all over and done with. Please remember that it is important for us all to cooperate with social distancing guidelines that have been put in place by our local, provincial, state, and federal governments and healthcare authorities. We all need to work together to slow down the coronavirus pandemic and to return our lives to some semblance of normality. Please stay at home so that we can flatten the curve and put an end to this problem that affects us all. If not for anyone else, Do it for Roman. And as always, that's been a word from Dr. Chris, not your everyday ortho.
Just a flesh wound.